Hello and welcome to a presentation by Sister Teresa Kirago and Father Stan Chu Ilo in the thematic area of the Vital Church. And our topic is Healing the Sick in Catholic Hospitals, Holistic Healthcare in Catholic Hospitals in Africa. And we begin by saying, healthcare is a subject that profoundly touches the life of us all. For the Catholic Church, the healing apostolate takes a special significance because of the central mission of the Church is integral salvation that satisfies the need of both the body and the soul. So Jesus' ministry on earth could be understood broadly as teaching, healing, saving, and liberating the whole person. So the Catholic Church considers healthcare to be a basic human need which flows from the sanctity of human life. Therefore, all healthcare workers are called to be guardians of the culture of life and therefore to be guardians of human dignity and the light to life. So this presentation adopts a healthcare system analytical method to assess the effectiveness of Catholic healthcare system in 3 hospitals, namely Achi Joint Hospital in Achi, Enugu State, Nigeria, St. Mary's Mission Hospital in Nairobi, and Consolata Mission Hospital in Nyeri, Kenya. Our research sought to find out how Catholic hospitals deliver holistic healthcare, particularly to the least of the brethren. This is why we adopted an equity healthcare assessment audit to understand some of the internal and external constraints facing the 3 Catholic hospitals. So our research was concerned with generating narratives and faith-based health leadership in Catholic hospitals and how the absence of the presence of adequate systems, staff, and spaces affect the access to healthcare for the poor. We also looked at healthcare service delivery in 3 hospitals in delivering optimal healthcare to people. What we find in many Catholic documents on health service are clearly articulated sets of ethical, spiritual, and pastoral principles that should guide the practice. What we don't find is a framework for implementing and assessing the delivery of optimal health. This is why we think that these factors are very important in more specific way of building and expanding and operationalizing the ethical and pastoral principles that guide the Catholic healthcare. And so we came up with the following. 1, Catholic healthcare services should offer a comprehensive and continuous holistic care. 2nd, Catholic holistic healthcare service should be accessible at the point of needs. That Catholic healthcare services should be available. 4th, Catholic hospitals should provide effective, safe, and timely services to the sick. The 5th, Catholic hospitals should run a coordinated healthcare system that puts the effort and commitment of the stakeholders and all people involved in delivering safe, timely, and accessible, comprehensive, and integrated care. And then 6, Catholic hospitals should be accountable. And just giving a scenario of one case study by St. Mary's Mission Hospital, we find that St. Mary's Mission Hospital, in regard to accessibility, the physical reach is one of the basic determinants of access, which is the ability to enter into a healthcare facility within 5 kilometers from the place of residence, or work only 50% or work to reach the place of residence or work. And we found that only 50% of the people are able to access health facilities within 5-kilometer distance. A major constraint on African healthcare, another point, is the user fee in Kenya. For example, the introduction of the user fee, also known as cash and carry approach, had negative impact on health of the population, even though to offset the individual cost, the government allowed several exemptions and waivers for the poor, children under 5, patients with HIV and AIDS. So the high cost of healthcare, particularly high out-of-pockets to patients, is a well-documented care access barrier. Then in terms of acceptability and utilization of the service, the respondent enumerated that Catholic identity was experienced in these hospitals through viewing the care of the sick and the dying in the eyes of Christ himself. So caring for the sick without boundaries in all aspects of their life. So looking at our sample, we recommend on the following. One, we recommend on the need for the person-centered healing as holistic health. Second, holistic healthcare in the ministry of accompaniment. And finally, the need for a shared and coordinated action for healing the sick in Africa. Thank you.